Welcome. Today we're diving into the essentials of clinical interviewing and the mental status examination, or MSE. Whether you're a student, a new clinician, or just curious about mental health assessments, this video will walk you through the key steps and concepts. Clinical interviewing is the foundation of gathering information, building rapport, and understanding a patient's needs. The MSE, on the other hand, is a structured way to observe and document a patient's mental state. Let's start by exploring why these skills are so vital in mental health care and what you can expect to learn in this guide. Clinical interview serves multiple purposes. It's not just about asking questions, it's about creating a safe, welcoming environment where patients feel comfortable sharing their thoughts and feelings. Through effective interviewing, clinicians can gather important information about symptoms, history, and functioning. This process helps informing accurate diagnoses and treatment plans. Remember, the way you interact can significantly impact the quality of information you receive. Let's look at the main goals of a clinical interview and how they set the stage for the mental status examination. Building rapport is the first and most crucial step in any clinical interview. Patients are more likely to open up when they feel respected and understood. Start with a warm greeting, introduce yourself, and explain your role. Use open body language and maintain eye contact, but always be sensitive to cultural differences. Listen actively, show empathy, and avoid judgment. These small gestures can make a big difference in how comfortable a patient feels. Establishing trust early on lays the groundwork for a productive and honest conversation throughout the interview. Before diving into sensitive topics, it's essential to discuss confidentiality and obtain informed consent. Explain to the patient that what they share will remain private, except in cases where safety is a concern. This transparency helps build trust and reassures the patient that their information is handled with care. Always check for understanding and answer any questions they may have. Obtaining consent isn't just a legal requirement, it's a sign of respect for the patient's autonomy and rights. Comfortable and private environment is key for effective clinical interviewing. Choose a quiet space free from distractions, and arrange seating to promote open communication. Make sure both you and the patient feel at ease. Simple touches like offering water or adjusting the lighting can help reduce anxiety. The goal is to create a setting where the patient feels safe to share openly. Remember, the physical environment can influence the quality of the interview just as much as your words. Start your interview with open-ended questions. These encourage patients to share their stories in their own words, providing richer and more detailed information. For example, instead of asking, "Are you feeling sad?" try, "Can you tell me how you've been feeling lately?" This approach helps uncover important details that might not surface with yes or no questions. Open-ended questions also show that you value the patient's perspective and are interested in their unique experience. Active listening is more than just hearing words, it's about understanding the meaning behind them. Show you're engaged by nodding, maintaining eye contact, and using verbal cues like "I see" or "go on." Reflect back what you've heard to confirm understanding and ask clarifying questions when needed. This not only helps you gather accurate information but also makes the patient feel heard and respected. Active listening is a cornerstone of effective clinical interview. Thorough history is essential for understanding the patient's current concerns. Start with presenting problems, then explore psychiatric, medical, family, and social history. Ask about previous treatments, hospitalizations, and any significant life events. This comprehensive approach helps you see the bigger picture and identify patterns or risk factors. Remember, every detail can provide valuable insight into the patient's mental health and guide your next step. Presenting problem is the main reason the patient is seeking help. Ask open-ended questions to let them describe their concerns in their own words. Listen for details about when the problem started, how it affects daily life, and any triggers or patterns. Understanding the presenting problem sets the direction for the rest of the interview and helps prioritize what to focus on during the mental status examination. Delve into the patient's psychiatric history by asking about previous diagnoses, treatments, and hospitalizations. Find out what worked, what didn't, and any side effects experienced. This information helps you understand the patient's journey and informs your approach to care. Be sensitive when discussing past experiences as they may bring up difficult memories. Your goal is to gather facts while showing empathy and support. Patients' medical history can have a significant impact on their mental health. Ask about chronic illnesses, medications, surgeries, and any recent physical health changes. Some medical conditions or medications can mimic or worsen psychiatric symptoms. Understanding the full picture helps you make accurate assessments and avoid missing important clues. Always consider the interplay between physical and mental health in your evaluation. Family history provides insight into genetic and environmental factors that may influence mental health. Ask about any family members with psychiatric conditions, substance use, or significant medical issues. This information can help identify risk factors and guide your assessment. Be sensitive as these topics can be personal or emotional for some patients. A supportive approach encourages honest sharing and helps you gather the details you need. Social history covers the patient's relationships, living situation, work, education, and daily activities. Ask about support systems, stressors, and any recent changes in their environment. Understanding the patient's social context helps you see how external factors may be affecting their mental health. This holistic view is essential for creating effective treatment plans and offering meaningful support. Substance use can significantly impact mental health and treatment outcomes. Ask about alcohol, tobacco, and drug use, including frequency, quantity, and any related problems. Be non-judgmental and supportive as patients may feel embarrassed or defensive. Understanding substance use patterns helps you assess risk, plan interventions, and provide appropriate resources. Once you've gathered a comprehensive history, it's time to transition to the mental status examination. Explain to the patient what the MSE involves and why it's important. Reassure them that this is a routine part of the assessment and that there are no right or wrong answers. Setting clear expectations helps reduce anxiety and encourages cooperation during the examination. Mental status examination, or MSE, is a structured assessment of a patient's current mental functioning. It covers appearance, behavior, mood, thought processes, cognition, and more. The MSE provides a snapshot of the patient's mental state at a specific point in time, helping clinicians identify symptoms, track changes, and make informed decisions about care. Let's break down each component of the MSE in detail. Start the MSE by observing the patient's appearance. Take note of their grooming, hygiene, clothing, and any unusual features. Is their attire appropriate for the weather and situation? Are there signs of neglect or self-care difficulties? Appearance can offer important clues about a patient's mental and physical health. Always document your observations objectively without making assumptions. Observe the patient's behavior during the interview. Are they restless, agitated, or unusually still? Do they make eye contact or seem withdrawn? Behavior can reflect underlying emotional states or psychiatric symptoms. Pay attention to movements, gestures, and any repetitive actions. Document your observations clearly, as these details can be important for diagnosis and treatment planning. Attitude refers to how the patient relates to the interviewer. Are they cooperative, hostile, guarded, or friendly? Attitude can influence the flow of the interview and the quality of information gathered. Be mindful of your own responses and adapt your approach as needed to maintain a positive and productive interaction. Evaluate the patient's speech for rate, volume, tone, and fluency. Is their speech rapid, slow, loud, or soft? Are there any unusual patterns, such as slurring or stuttering? Speech can reveal a lot about a patient's emotional state and cognitive functioning. Document any abnormalities and consider how they might relate to underlying mental health conditions. Mood is the patient's sustained emotional state as described in their own words. Ask how they're feeling and listen for terms like sad, anxious, or angry. Mood provides insight into the patient's inner experience and can guide further assessment. Always use the patient's own descriptions when documenting mood. Affect refers to the observable expression of emotion. Is the patient's affect appropriate to the situation, or is it flat, blunted, or labile? Compare their affect to their reported mood and note any discrepancies. Affect can provide clues about underlying psychiatric conditions and help you understand the patient's emotional state. Assess the patient's thought process by observing how they organize and express ideas. Is their thinking logical and coherent, or is it disorganized, tangential, or circumstantial? Thought process abnormalities can be signs of psychiatric disorders like schizophrenia or mania. Document your observations and ask clarifying questions if needed. Thought content refers to what the patient is actually thinking about. Ask about delusions, obsessions, phobias, or suicidal thoughts. Be sensitive and non-judgmental when exploring these topics. Document any abnormal beliefs or preoccupations, as they can be critical for diagnosis and safety planning. Perceptions involve how the patient experiences the world through their senses. Ask about hallucinations, illusions, or any unusual sensory experiences. Hallucinations can be auditory, visual, or involve other senses. Document the type, frequency, and impact of these experiences, as they can be important for diagnosis and treatment. Cognition covers a range of mental abilities, including orientation, attention, memory, and abstract thinking. Test orientation by asking about time, place, and person. Assess attention with simple tasks and check memory by asking about recent and remote events. Evaluate abstract thinking with proverbs or similarities. Cognitive deficits can indicate neurological or psychiatric conditions. Insight refers to the patient's awareness and understanding of their condition. Ask if they recognize their symptoms and the need for treatment. Insight can range from full awareness to complete denial. Assessing insight helps you gauge the patient's readiness for change and tailor your approach to care. Judgment involves the patient's ability to make sound decisions in daily life. Ask about hypothetical scenarios or recent choices to assess their reasoning. Poor judgment can be a sign of cognitive impairment or psychiatric illness. Document your findings and consider how judgment may impact the patient's safety and functioning. Reliability refers to how accurate and consistent the patient's information appears. Compare their statements with available records or observations. Note any inconsistencies or signs of exaggeration or minimization. Assessing reliability helps you determine how much weight to give the patient's self-report in your overall evaluation. After completing the MSE, summarize your findings in clear, objective language. Highlight any abnormalities and note areas of concern. This summary provides a snapshot of the patient's mental state and guides further assessment and treatment. Always document your observations promptly and thoroughly. Culture can influence how patients express symptoms and interact during interviews. Be aware of cultural differences in communication, beliefs, and behaviors. Ask about cultural background and preferences and adapt your approach as needed. Respect for diversity enhances rapport and ensures a more accurate assessment. Interviewing children, older adults, or individuals with disabilities requires special considerations. Adjust your language, pace, and questions to match the patient's developmental level and needs. Use collateral information from family or caregivers when appropriate. Tailoring your approach ensures a more accurate and compassionate assessment. Assessing risk is a critical part of the clinical interview and MSE. Ask about suicidal thoughts, self-harm, or harm to others. Explore protective factors and warning signs. Document your findings and take appropriate action if there are safety concerns. Risk assessment helps protect both the patient and others. Accurate documentation is essential for continuity of care and legal protection. Use clear, objective language and avoid jargon or assumptions. Record both the patient's statements and your observations. Timely and thorough documentation ensures that important information is available for future reference. Be aware of common pitfalls in clinical interviewing and MSE. These include leading questions, making assumptions, or failing to explore important areas. Stay curious, open-minded, and thorough. Reflect on your practice regularly to identify areas for improvement and ensure the highest quality of care. Collateral information from family, friends, or other providers can enhance your assessment. With the patient's consent, gather additional perspectives to fill in gaps or clarify inconsistencies. Collateral information is especially helpful when the patient's reliability is in question or when assessing children or those with cognitive impairment. After completing the interview and MSE, integrate all the information you've gathered. Look for patterns, inconsistencies, and areas needing further exploration. Use your findings to develop a working diagnosis and treatment plan. Integration ensures that your assessment is comprehensive and tailored to the patient's unique needs. Providing feedback to the patient is an important part of the process. Share your impressions in a clear and supportive manner and invite questions or concerns. Collaborate with the patient to set goals and discuss next steps. Feedback fosters engagement and empowers the patient in their care. Don't hesitate to seek supervision or consultation when faced with complex cases or uncertainty. Discussing cases with colleagues can provide new insights and support your professional growth. Supervision is a valuable resource for learning and ensuring high-quality patient care. Ethical practice is at the heart of clinical interviewing and MSE. Respect patient autonomy, maintain confidentiality, and avoid dual relationships. Stay informed about ethical guidelines and seek guidance when faced with dilemmas. Ethical practice protects both you and your patients. Be prepared to respond to crises such as suicidal ideation or acute distress during interviews. Know your organization's protocols and resources for crisis intervention. Act quickly and decisively to ensure safety and document your actions thoroughly. Crisis intervention skills are essential for all mental health professionals. Clinical interviewing and MSE can be emotionally demanding. Prioritize your own self-care to prevent burnout and maintain effectiveness. Seek support from colleagues, engage in regular supervision, and practice stress management techniques. Taking care of yourself enables you to provide the best care for your patients. Mental health care is always evolving. Stay current by attending trainings, reading new research, and reflecting on your practice. Continuous learning helps you refine your skills and provide the highest quality care. Embrace opportunities for growth and stay curious about new developments in the field. Let's recap what we've covered: the importance of clinical interviewing, the structure of the mental status examination, and practical tips for effective assessment. Remember, these skills are foundational for mental health professionals and play a vital role in patient care. Review your notes and keep practicing to build confidence and competence. Thank you for joining this comprehensive guide to clinical interviewing and the mental status examination. By mastering these skills, you'll be better equipped to support your patients and contribute to their well-being. Keep learning, stay compassionate, and remember that every interview is an opportunity to make a positive difference. Wishing you success in your mental health journey.